There are certain illnesses where overtreatment can quietly become a double-edged sword that harms the health of older adults instead of helping them. As we enter our twilight years, staying healthy becomes a top priority. But ironically, many seniors fall into the trap of excessive treatment, taking too many medications, chasing after countless unnecessary therapies, slowly wearing down their bodies without even realizing it. Instead of living a healthy life, they end up suffering from even more issues, all because of being too careful with their health care. In today's video, we are going to reveal 6 common health conditions that elderly people should avoid overtreating. This is incredibly important information because it could help you or your parents or grandparents steer clear of serious health mistakes and preserve both the quality of life and mental clarity during those most precious golden years. Before we dive in, drop a positive affirmation down in the comments as a way to commit to attracting good things into your life. Something like, "I deserve a healthy and peaceful old age," or anything else you personally wish for. And do not forget to like the video and subscribe to the channel so you will not miss out on any valuable content like this. Let us build a space filled with positive energy, growth, and success together. Now let us find out if you or your loved ones might be falling into the trap of overtreating any of these 6 conditions. 1. Eye conditions. In older adults, eye problems like cataracts, glaucoma, macular degeneration, or dry eyes are common signs of aging. However, what is concerning is that many people try to treat these issues excessively, hoping to preserve the same vision they had in their younger years. They use eye drops constantly, or even go through surgeries that may not be truly necessary, exposing their already delicate and sensitive eyes to avoidable damage. Certain eye drops, such as those for redness relief, dry eye treatment, or lowering eye pressure, can cause irritation, dependency, or even corneal damage when used long-term. Many people, because of minor discomfort, start using medication on their own for months, which can lead to more severe dry eye or conjunctivitis. Even worse, some eye drops that contain corticosteroids can actually cause secondary glaucoma or speed up cataract development, the very problems people are trying to avoid. The truth is, many age-related changes in vision, like blurry sight in the morning, light sensitivity, or slower eye adjustment, are completely normal and do not require aggressive treatment. The goal of eye care for older adults is not to have perfect vision, but to maintain enough clarity to read, watch television, move around safely, and live independently. Medical intervention should only happen when there are clear signs impacting daily life, not just based on test results. Instead of stressing over every little abnormality, try caring for your eyes more gently. Get enough rest, wear anti-glare glasses, and include eye-friendly nutrients in your diet like omega-3, lutein, and vitamin A. At this stage of life, the goal is not to have eyes as sharp as they were in youth, but to live safely, peacefully, and in harmony with your body. Wise treatment means knowing when to act and when to stop. That is the true way to stay healthy, smart, and light-hearted each day. 2. Age spots. In older people, age spots, also known as liver spots, often appear on the skin as a natural part of aging. These spots are usually harmless, do not cause pain or itching, and are not linked to skin cancer. But still, many people feel self-conscious about them and go out of their way to try to get rid of them. That is where the problem starts. The harder you try to erase them, the more likely you are to damage your skin. Treatments like laser therapy, chemical peels, cryotherapy, or strong bleaching creams can cause irritation, light burns, or even scarring, especially since older skin is thinner, more fragile, and heals more slowly. On top of that, using the wrong topical medications can lead to pigment loss, skin inflammation, and make the condition worse. Many people, driven by appearance anxiety, forget that aging skin does not need to be flawless. It needs to be healthy, free from infections, cracks, or discomfort. Overtreating can cause both physical damage and emotional stress, pushing older adults to feel like they must reverse their skin's age, when really that is not necessary at all. Instead of harsh procedures, a safer path includes gentle moisturizers, sunscreen, healthy eating, and learning to embrace the marks of time on your body. Because age spots are not flaws, they are proof of a life lived, experiences had, and years that deserve to be honored. Third, mild cholesterol imbalance. When older adults go in for routine health checkups and are told they have mildly elevated cholesterol levels, like slightly higher levels of low-density lipoprotein or slightly lower levels of high-density lipoprotein, the usual response from doctors is to prescribe statin medication right away in order to prevent heart disease. But here is the question we really need to ask. Is it truly necessary to start taking medication immediately, especially when the person has no symptoms and the numbers are only a little outside the normal range? For younger or middle-aged adults, aggressive cholesterol control can help prevent heart attacks and strokes down the line. But in older age, things need to be looked at through a different lens. The aging body does not function the same. Liver and kidney performance declines, and the body becomes less efficient at absorbing and processing medication. Taking statins for a long time can cause muscle damage, aches, weakness, and even raise the risk of type 2 diabetes or liver failure, sometimes more dangerous than the original cholesterol concern. What most people do not realize is that having mildly imbalanced cholesterol does not always mean there is a high risk of heart disease. Many older adults naturally have higher levels of low-density lipoprotein, but they have no history of heart problems, they do not smoke, their blood pressure is stable, and they lead active, optimistic lives. In situations like these, taking medication might not bring any real benefit. Instead, it can lead to unnecessary worry, extra medical expenses, and unpleasant side effects. In fact, some studies suggest that in older adults, extremely low cholesterol levels might actually be linked to a higher risk of death, possibly due to malnutrition, chronic illness, or weakened immunity. So, forcing cholesterol too low is not always a sign of good health. The key is to distinguish between a condition that needs treatment and a number that needs monitoring. For mild cholesterol issues without other risk factors, lifestyle changes like eating healthier, staying active, cutting down on fried foods, and getting proper rest are often enough to improve the situation without the need for medication. 4. Osteoporosis. Without severe symptoms. Osteoporosis, the very name alone, can make many older adults feel anxious. But what most people do not realize is that not every case of osteoporosis needs to be rushed into with strong medication, especially when the person has never had a fracture, is not experiencing noticeable pain, and the condition is only mild to moderate. These days, a lot of people have their bone density checked as part of a routine health screening. And when the results show a T-score lower than -2.5, they are often prescribed osteoporosis medication right away, usually from a group of drugs called bisphosphonates. That might sound reasonable at first, but here is the truth. Osteoporosis medication is not the same as taking a daily vitamin, and it is definitely not without risks. These drugs, when used long-term, can lead to a range of serious side effects that many people are not aware of. Jawbone necrosis, esophagitis, chronic joint and muscle pain, and even an increased risk of unusual fractures. Breaks that happen not from falling, but simply because the bones have become unusually brittle. Ironically, a drug meant to strengthen bones could end up making them weaker if overused. What is more, older adults already have a harder time absorbing calcium and vitamin D, so even if they are taking medication, it will not work effectively without the right nutrition and physical activity. Treating osteoporosis with only medication without changing one's lifestyle is like building a house on sand. Another key point: fracture risk is not based on bone density alone. Some people with low bone density never fall because they have good balance and strong muscles, while others with only mild bone loss may fall more often due to weak legs or poor vision. That means preventing fractures is not just about medication. It is about improving muscle strength, balance, and making the living environment safer. So if you or a loved one has been diagnosed with osteoporosis but has no symptoms, no pain, and has never had a fracture, do not rush into strong medications. Instead, focus on getting enough calcium and vitamin D through diet, staying active with regular exercise like walking, gentle yoga, or resistance training, all of which can naturally and safely improve bone density. Growing older does not mean living in fear of every test result. Befriend your body, listen to it, and take care of it wisely, not in extremes. Osteoporosis is not the end, but treating it the wrong way could be the beginning of a chain of complications no one wants. 5. Mild, asymptomatic hypothyroidism. Hypothyroidism is one of the most common hormonal disorders among older adults, and in many cases, people only find out they have it after a routine blood test. But here is the important thing. When hypothyroidism is mild and there are no clear symptoms, especially in seniors, starting hormone replacement therapy right away might actually cause more harm than good. It might sound surprising, but even the world's leading endocrine associations have confirmed this. For older adults with mild, symptom-free hypothyroidism, immediate treatment is usually not necessary. And here is why. First, thyroid function naturally slows down with age. So when the thyroid-stimulating hormone level is slightly higher than normal, which is a sign of mild hypothyroidism, it might simply be the body's way of adjusting to aging and not a condition that needs to be treated. Starting thyroid hormone replacement, like levothyroxine, too quickly can disturb heart rhythms, increase the risk of osteoporosis, cause trembling hands, or lead to trouble sleeping. These effects are especially risky for people who already have heart problems or unstable blood pressure. Second, mild hypothyroidism without symptoms does not usually affect someone's quality of life in a serious way. Many people in this situation still have a good appetite, sleep well, remember things clearly, and stay active, even if their test results are not perfect. On the other hand, once you start taking thyroid hormones, it becomes a lifelong commitment. You have to go for regular checkups, and there is always the risk of taking too much, which can push your body into a state of hypothyroidism, with its own complications. A common mistake is jumping to treatment just because the thyroid-stimulating hormone number is high, without considering the person's age, other health issues, or how they actually feel. But medical decisions should never be based on numbers alone. They should be based on the whole person, how they live, how they feel, and what they truly need. So if you or someone you care about has been diagnosed with mild hypothyroidism but does not have signs like constant fatigue, severe constipation, heavy hair loss, depression, or dry and cracked skin. There is no need to panic or feel pressured to start medication right away. Often, just regular checkups, a healthy lifestyle, eating foods rich in iodine and selenium, and getting enough rest are more than enough to keep the thyroid working properly without any medical intervention. And finally, let me say this clearly. Older adults should be cared for in a way that supports healthy aging, not by using the same medical standards as younger people. Every decision about treatment should balance the benefits and the risks, and sometimes the smartest and safest choice is simply to do nothing right away and just keep watching closely. 6. Constipation. It might seem like a small issue, but constipation is actually one of the most common and bothersome problems for older adults. It does not just affect day-to-day comfort, it also impacts mood, sleep quality, and even self-confidence. That is why many seniors, or the family members caring for them, try everything they can to solve it once and for all, using laxatives, dietary supplements, or even regular use of enemas. And that is where a small issue can easily turn into a serious health risk if treated excessively. The human body, especially the digestive system, operates on a very delicate biological rhythm. When laxatives are used long-term, especially those with strong effects, the colon gradually loses its ability to contract on its own. Over time, the body becomes dependent on the medication just to have a bowel movement. This condition is known as laxative-induced constipation, and it is very difficult to reverse because the digestive system has gotten used to outside help and has lost its natural reflex. It gets worse. Some types of laxatives can lead to electrolyte imbalances, dehydration, fatigue, low blood pressure, and even irregular heart rhythms. For those with existing heart or kidney conditions, the consequences could be far more serious than constipation itself. One major issue is that older adults often mistake going less often for a serious illness. Some people worry after just 1 or 2 days without a bowel movement and start taking all kinds of medications, when in reality, having a bowel movement 2 to 3 times per week is still completely normal, as long as there is no pain, discomfort, or bloating. That kind of anxiety leads them into a cycle of medication and unnecessary mental stress. The sustainable solution to constipation in seniors is not medication, it is lifestyle. Drinking enough water, increasing fiber from vegetables, fruits, and whole grains, and getting gentle physical activity like walking, qigong, or yoga can make a world of difference. On top of that, building a consistent daily bathroom routine at the same time each day without rushing or stress can help the body naturally reset its digestive rhythm. Constipation is a small issue when viewed the right way, but it can turn into a silent monster if treated the wrong way. In old age, the goal is not to make everything perfect, but to do things in a way that is in harmony with your body, just enough to live each day peacefully and comfortably. We are not denying the role of modern medicine, but what is even more valuable is learning to understand your body, listening to even the smallest signals, and making smart choices to live a healthy life with quality, not just a life spent chasing lab results. If you are taking care of aging parents, or if you yourself are in your golden years, always remember this. Real health is not measured by how many pills you take each day, but by how you feel each morning when you wake up, with energy, with clarity, and with a joy for life. And before we wrap up, leave a comment below as your personal commitment to aging well. Write something like, "I choose to live healthy, light, and clear-minded every day," or any other positive wish you want to declare. And do not forget to like this video and subscribe to the channel so you will not miss out on more helpful tips for health and happiness in your later years. Let us build a community of strong, sharp-minded and joyful seniors together. Thank you for watching until the very end. We will see you in the next video.